This is Doogie. He's a 1.5-year-old wire-haired Jack Russell. The reason for the significant restraint and the muzzle has nothing to do with the freezing procedure. It's entirely due to his temperament. I have both shaved this area and infiltrated with a small amount of lidocaine with epinephrine, only because it's along the ear margin and I suspect it's going to be a little sensitive. We're going to do a 40 to 45 second freeze, followed by a thaw cycle, followed by a second freeze cycle. And then we will give it approximately 2 to 3 weeks to fully go through a cycle. If at that point in time there's any remaining tissue, as there is some depth to this mass, we'll go ahead and just touch it up at that point in time. I typically charge for the block and the freeze procedure. If I do a touch-up at a later date, I do that inclusive of the first charge. So if someone has a watch and we can start timing this. Heather, give me 40 seconds. Tell me when to start. By the way, we're trying to make sure that we get contact with the mass, and so we are literally scraping or brushing off the frost as it occurs. The reason for the masks is because of COVID. It has nothing to do with the freeze procedure. And as far as gloves are concerned, what I found is I wear gloves because I would prefer not getting the frost on my fingers, but it is not necessary. How are we doing, Heather? Okay, so there's a 40-second freeze. We're going to shut the video and come back after the thaw cycle. So following a thaw cycle, we're going to go ahead and refreeze. We're looking for the most rapid freeze that we can get directly on the tissue, as that creates the greatest damage on a cellular level. Because this is on an ear margin and centrifugal force tends to cause them to bleed, I have recommended that clients either use an Elizabethan collar, which the dogs hate, or alternatively a knee sock inverted over the head to keep the ear that's been treated flat against the cranium. Heather? Post freeze cycle, it'll probably take in this particular ear about 2 minutes to thaw. We sometimes see some serous oozing and on a rare occasion some bleeding. I have clients just utilize a little styptic to prevent any bleeding in the house. And of course I've trimmed off some of the long hair so that during the necrosis cycle we don't get adhesion of hair on top of the mass. We'll see it in 3 weeks, and if it's completely gone in this particular ear, there'll be a defect in the lid margin, the pinna margin, but it shouldn't be unsightly once the hair's grown back in. This is Cooper. He's a 9-year-old Labrador mix. He has a small dermatologic, probably fibroma, on his left lateral cubitus. Basically, this is mostly aesthetic. I indicated to the owner that we probably should leave it alone. The owner requested it be removed as a result of the dog bothering at it, and specifically the owner last night with tweezers trying to remove what he thought was a tick made all these small holes in the skin just adjacent to it. So we're going to cryo this lesion today. We're going to use the D3 tip. We're going to freeze it. Freeze cycle is about 30 seconds because it is not a overly large mass. It's about 3 millimeters in diameter. We're going to go through a thaw cycle and refreeze it again. You'll notice that I'm trying to break away or push away as much of the frost as possible so that we have good contact with gas and tissue, and that we get a very rapid freeze cycle. The rapid freeze cycle yields ice crystals intracellularly, which will rupture the cell wall. Now we're going to let it thaw. Not uncommonly after the thaw cycle, the lesions are a little erythematous. Sometimes they're injected. We're going to go ahead and freeze this again a second time. Same procedure, trying to knock away any ice crystals that may form so that we get gas contact with the lesion. I am wearing gloves this time, and I did use a little lidocaine because this dog is a little fractious. And that's what it looks like following the second freeze cycle. This is Charlie. He's an approximate 12 to 13-year-old male neutered Patterdale Terrier. He was in for radiographic workup of his lumbar compressive lesion. And while he was here, the owner asked if we could please address this chronic bleeding papillomatous mass. Rather than surgically remove it, I offered to cryo or freeze this mass so that we could shorten the anesthetic exposure and decrease the cost incurred to the client. Lastly, Charlie is somewhat of a fractious dog, and taking sutures out after the fact in and of itself would have required some type of sedation. So we're going to freeze this lesion. Given its broad base, we're going to use the D3 tip. We're going to freeze it 2 cycles, approximately 45 seconds each, with a thaw cycle in between, and we'll recheck it in 3 weeks. Most of these lesions will be completely resolved. In some cases where the mass or growths are extremely thick or alternatively large, we may require a follow-up treatment 3 weeks out. Again, these are typically done without anesthesia and without any type of local preparation. In some cases with fractious animals or masses around the face or the genitalia, I will put a bleb of lidocaine under them so as to reduce the sensation at the site of freezing. Please, if you see mask and other alternative gear on, it is not for the specific purposes of treating these lesions. It is because we are following a coronavirus or COVID-19 protocol. So we're going to start on one edge of the lesion. We're going to check our time, and again, approximately 45 seconds. As we go through, we are attempting to get to the root of the lesion and knock off any ice crystals that may interfere with the rapid freeze cycle, which is necessary for destruction of the mass. Because this is very broad-based and close to the skin, and I can feel the skin getting very cold, I'm going to shorten the cycle to about 30 seconds. So we've just completed the thaw cycle, which typically is 1 to 2 times the duration of the freeze cycle. You'll notice that I'm not wearing gloves. I typically don't wear gloves, so I have a comfort level with the temperature of the surrounding skin. Again, this mass is very broad-based, but not very thick, and as a result of which I want to move quickly to freeze the mass and not to freeze the surrounding skin. It is a requirement of the freeze cycle to freeze the tissue as quickly as possible, which will form ice crystals and therefore subsequent rupture of the cells associated with the mass. So again, we're going to freeze, knocking off ice crystals as we go, so as to make sure that the gas is in direct contact with the mass. Secondly, what I find is that this freezes a lot quicker than the other types of cryotherapies that I've used in the past. and I find it advantageous. It also is a lot more exacting than the cone approach to freezing. And I think that will be sufficient. Well, this is Roxy, a 12 plus or minus year old mixed breed Westie who was presented for multiple cutaneous papillomas. As you can see, they're quite extensive, and surgical removal would be both quite involved as well as create quite an expense. The owner has elected to cryo all of these papillomatous masses in an attempt to forego an extensive anesthetic procedure. We're going to one by one freeze these with approximately a 30-second freeze cycle, thaw cycle, and a freeze cycle again for 30 seconds. Remember, we want to make sure that we're knocking any material off of the surface so that we get good contact and quick freezing. We don't want any ice crystals building up, preventing contact. So we're going to freeze this for 30 seconds. Again, I'm knocking these crystals off as I freeze. We're going to do a 30-second freeze cycle, followed by a thaw cycle and a refreeze. Heather, how are we doing?
5 more seconds. 30 seconds.
Okay. So we have put a little lidocaine subcutaneously on all these masses. This dog is a little bit fractious, as well as the number of lesions present instigated the desire to block these lesions.
5 more seconds. 30 seconds.
Some of these are more tissue dense, and so we are extending the freeze cycle for 45 seconds. There are additionally some papillomatous masses on the distal limbs where surgical removal would be very difficult due to the lack of sufficient tissue for closure. This particular distal limb papillomatous mass is both interdigitally as well as right at the metacarpal phalangeal joint, and these tend to elicit a lot of attention postoperatively from Westie type breeds. So this is what the lesion looks like post-thaw. We're going to go ahead and refreeze these for 30 seconds. I find that the fleshy masses do require a double freeze cycle to cause complete regression. Typically, I recheck these in 3 weeks. And if at 3 weeks there's any remaining tissue, done? If there's any remaining tissue at that point in time, I will touch it up at no charge to the client. Overall, response is probably 85 to 90%, and client satisfaction is very high. There is minimal to no post-cryo complications. Occasionally, we'll find a dog will lick at these lesions. Occasionally, these dogs will lick at the lesions, and so we'll use a body stocking or an Elizabethan collar to prevent self-trauma during the necrosis and healing phase. Again, client satisfaction is very good, patient acceptance is excellent, and post-cryo scarring is minimal at best.
Done. Done.
You'll notice that we're wearing masks. This is not done for the cryo procedure purposes. This is done as we are still suffering under the COVID limitations.
Done.
Yeah, in contrast, we're going to utilize a, let's call it a less exacting procedure, which is to utilize the cone to isolate the lesion and then apply cryo to it. This is a much less exacting procedure. I don't know if you noticed, but it is splashing out of the cone, and I just got hit in the eye with a little bit of the cryo solution. What I find with this particular procedure is, as it is less exacting, you'll sometimes find necrosis to the periphery around the lesion. Additionally, you'll sometimes notice that the isolator will get stuck and tear some of these lesions. Lastly, what we'll sometimes find is that you don't get complete freezing at the base of the lesion, as you can't physically direct the solution to the area that is indicated. If it is not a surface that is flat or smooth, as in interdigital regions, you get significant leakage of the cryo solution. So we're here this afternoon. We're going to do a cryo pen on Nati. Nati's a 10-year-old English Spaniel, and she has two masses that are cutaneous in nature, yet benign. One is on her left cervical region, the other is on her right mandibular labia. We're going to put a little lidocaine bleb under each of them. I find that it's not necessary, but she's a somewhat fractious dog, and I think that in her particular case, it's going to make life a little bit easier. Elbow up, Heather. Thanks, Heather. And we're going to need to shave this. We didn't shave it. So after I put the lidocaine in, we'll give it a little shave, let the lidocaine work. So we're going to go ahead and freeze this mass from the base to the apex. We're going to freeze it over a period of about 45 seconds. We're going to do our best to remove any of the ice that is forming, so we get the application of cold directly on the tissue. Once the mass is completely frozen, we'll go through a thaw cycle. Given the large size of this mass, we're going to use the D3 tip. And again, we're going to freeze the entire mass. We're going to work on approximately 50% of the mass at a time because of the size of this mass. And then we'll move to the other side. And we're running out of gas. Making sure that we knock off any ice crystals so we get the full thermal effect on the mass. Again, the lidocaine is not necessary, but in an area of the face, definitely makes it less arduous to get the mass frozen. Go back to the other one. So this is the mass post-thaw cycle, and we're going to start again at the base, freezing as we go. Knocking off any accumulation of frost so that the mass has as quick a freeze cycle as possible. Okay. So this is the mass post-thaw cycle, and we're going to again start at the base, and we are using the D3 tip, and we're going to freeze this mass in a uniform manner, knocking off the ice crystals as they form. Stop for a second, Tori. Okay, Nancy. The goal here is to freeze as quickly as possible so as to form ice crystals intracellularly and rupture the cell membranes to ensure that you have a complete freeze. With a tissue this size, the depth of the tissue is such that you need to ensure that you have the mass completely frozen. That's what the mass looks like post-freeze. It'll probably take in a mass this size approximately 3 weeks for this tissue to completely necrose and scab over, at which point we typically recheck them. In some cases, in a large mass as this one, we'll need to do a repeat treatment. So this is Lorenzo. He's a 12-year-old golden retriever. Lorenzo has a prior medical surgical history of having a right front P2 removed for digital melanoma. He is currently on melanoma vaccine, and he has this papillomatous lesion by his eye, which has repeatedly bled and causing distress to the eye. Due to the proximity to the eye, I have put a bleb of lidocaine subcutaneously, and I'm actually using the little measuring device to shield the eye. We're going to go ahead and use the D2 head and freeze the lesion for approximately 40 seconds. making sure that we knock off any ice crystals that may form so that we get rapid freezing of the tissue. And the plastic also helps prevent freezing of the surrounding tissue. I'm going to go ahead and let that thaw and go through a single freeze thaw cycle, and we will repeat the freeze shortly. So now that the lesion has thawed, we're going to go ahead and do a repeat freeze cycle. Again, I'm using the plastic measuring device just to prevent the surrounding tissue from freezing. Knocking off any ice crystals as we go, covering the entire lesion, and freezing as quickly as possible so as to cause destruction of the cellular membrane. So, post-second freeze cycle, we typically send these dogs home without any medication whatsoever, and the lesions typically dry up and fall off within the ensuing 3 weeks. On a rare occasion, there are some residual areas that need to be refrozen, and I typically do those at no charge to the client.